Good afternoon, everyone. You are very welcome to the Women's Health Awareness Month. It's Over to You webinar. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC laptop screen. If you are using an iPad, you will find this feature located at the top of your screen. Without further ado, I will now hand you over to your host, Elaine Prendergast, Head of Services. Thank you.
Hello everyone, and you're very welcome today to this webinar called It's Over to You, which is a series of events to mark Women's Health Awareness Month in Community Healthcare West. As the host has said there, my name is Elaine Prendergast and I'm the Head of Service in Health and Wellbeing here in Community Healthcare West. Today we hoped through this webinar to create a platform where women can openly discuss any issues concerning their health. Today we have 4 women health experts on our panel. Let me introduce them to you. Dr. Roisin O'Loughlin is a GP and her specialist interests are in fertility, preconception care, menopause, benign gynecology and contraception. She's also a member of the British Menopause Society. Dr. Claire Thynne is a senior clinical psychologist here in Community Healthcare West, and she has more than 20 years of experience of working with adults and children experiencing mental health challenges. Lisa Corbett is a senior community nutritionist, also here in Community Healthcare West, with also over 20 years of experience. Ogechi Nseodo is a physiotherapist and she works in the Health Promotion Department in Community Healthcare West. She has 18 years of experience of working with women on complex pelvic health conditions. Today, our panelists will be answering your questions. We already have a list of questions that have come through the registration process, and feel free to add any of your questions to the Q&A function. We will endeavour to answer them all as we go through the session today. So I'm just going to start with a general question about general health. And Roisin, I might start with you there. What are the general health checks women should get with their doctor and GP?
Thanks, Elaine, for your question. Yeah, I guess it starts really from the time when women get periods. And now that we have free contraception up to the age of 25, I think that's a really important change that has come about in Ireland over the last couple of months. The rate of unplanned pregnancies in teenagers is very, very high in Ireland. So that's a good start, I guess, is contraception as a first point. The next thing we move on to would be cervical smears. So cervical screening program is available every 3 years for women from the age of 25 to 30, and then every 5 years for women over the age of 30. So that's a really, really important check to get with your GP or your GP nurse. Following on from that then would be fertility screening is really, really important. And I guess more and more we're seeing couples struggling with fertility. The current rate is supposed to be 1 in 6 couples would have difficulty conceiving. And there seems to be much more awareness now, and a lot of patients are coming in, getting their hormones checked, getting their AMH level checked, which is their anti-Müllerian hormone, which is a marker of their ovarian reserve. And just in general, coming to their GP and talking about planning for pregnancy and preconception.
Great. Thank you.
Perfect.
And that leads me on then to my next piece, which is about healthy bones and bone health and exercise. So again, an important part, for ladies. So Lisa and Ogechi, maybe between the two of you, you might be able to give us some information in relation to that.
Thanks, Elaine. Well, I suppose bone health is important, obviously, throughout life, and and you know, it starts, I suppose, from the very start when a baby is born. If a mother breastfeeds the baby, then she will have more calcium in her system and is less likely to go on and have osteoporosis in later life. And throughout life, I suppose the importance of having enough calcium and vitamin D in the diet to maintain and build healthy bones is really important. So the peak bone mass is reached in the late 20s, early 30s, and from there on we don't absorb as much of the calcium and vitamin D to strengthen our bones as what we did prior to that. So it's really important that we keep up our portion sizes, and we have our 3 servings from the dairy shelf of the food pyramid that's up here behind me. I'm sure everyone's familiar with that anyway, that we have our 3 servings from that, so with milk, cheese and yogurts. Again, the low fat varieties have just as much and often sometimes even more calcium than the full fat varieties, which is also beneficial then for our cardiac health and everything as well if we reduce our fat intake. So obviously weight bearing exercises is something else, and maybe I'll let Ogechi maybe talk about that.
Thank you very much, Lisa. Yeah, I feel it goes 2 ways, really. The diet to complement the burning of energy and making sure that you're burning the energy effectively. So you need to be able to feed the bones as well as strengthen it at the same time. So both has to work in the same kind of complexity. So the way I would describe our bones, as we grow, we get all that structure. There is all that strength building up in it based on what you've eaten in your diet. But for us, especially as we start to wean off into the later stages of life, the replenishment of those bones begin to, you know, slow down. So almost imagine it as a scaffold. So you need your food, you need good, healthy food, you need exercises, weight-bearing exercises to almost create that scaffolding structure to help to kind of support those bones right up until the very end. And osteoporosis is actually high among women mainly, and that's just because of either the menopause, the depletion in the estrogen levels. So it's very important. Walking, little exercises like that, resistant exercises, all those things go a long way in trying to help with our bone health.
Okay, thank you.
And in line with that, just I think
yeah.
I forgot to mention vitamin D. So just to say that vitamin D is obviously also really important for the absorption of your calcium. So many of us don't reach our vitamin D requirements. I suppose we don't get very much sunlight here either. So it's often advisable for people to take a vitamin D supplement just to assist with their calcium absorption as well. And there's lots of other benefits to having vitamin D as well. So if you don't meet it from your diet, some foods will be fortified with vitamin D. You'll get some from there, but in general in the population we don't meet our vitamin D requirements, so it might be one where supplementation might be advisable.
Okay, and Dr. Roisin, is there anything else you'd like to add there?
No, I think the girls explained that all really, really well. I guess like osteoporosis is very, very common in Ireland, and I think particularly as women approach the menopause, it's a really important thing to discuss with your GP. How to prevent osteoporosis, and also if there is risk factors for osteoporosis, that you may organise a DEXA scan at your local hospital and to see what your bone mineral density is like as a starting point, and go from there.
Excellent, excellent. Thank you very much for that. I think one of the questions came in that we're asking about bone health there, so I hope that answered the question for you. Just then on stress and all those kind of things that women have to cope with as well through their working life. And so I suppose one of the questions that has come in has asked about moving jobs within the HSE and that they're finding it hard to settle in new teams and locations. And there's a feeling that they're not up to the job. Claire, you might give us some help in relation to that, please.
Yeah, and I mean, I think in times of transition, particularly women in general, I think we almost think, why can't I manage this better, with very high expectations, and there's nothing wrong with that. But I suppose I'd caution our kind of, to this lady with the question is, I'm not up to the job. It seems very categorical, and I wonder, is she being a little bit too broad stroke or too harsh? And I think we're all guilty of this. inner critic that really does attack our resources and our well-being. So I suppose with any problem is to take it out and unpack it a little bit. What are the sources of stress? Is it the colleagues aren't very congenial? Is it the commute is longer? Work expectation? Can she ask anyone in the job for more clarity of role? And I've experienced this myself. If you move job and you're in an organization for a long time, you have huge expectations that day one you're going to know exactly what to do, how to do it, and this real drive to be competent. And there's nothing wrong with that, but that is an unrealistic expectation. You're new to the job, you don't know it all, you can't know it all. And I suppose then it's about asking and re-asking. And I've been there, and it's hard. It's hard to start again when you've reached a level of competence in job A and you move to job B. So I think it's that self-compassion, and I belt on about this every day in my professional life, and I don't know what it is about Irish women or women in the health service, but and in the general population, we're really hard on ourselves. We really have this drive to be all things to all people a lot of the time, and we do our best, but I think it's okay to say, this is my best, I'm new in this job. I'll get there, and to seek clarity from management, and also just down the line, say if this lady is really, really unsettled and it's not working out, we have excellent support services certainly in Galway. I'm sure the same in Mayo, the Employee Support Agency based in Merlin Park here. I've been a client of theirs myself. We go through tough times. It's great to have a professional. They were very professional, empathic, just to hear us out. They're not a work colleague. They're not married to us. They're not our friends. And just to give us that space to really examine what's going on here. Why am I so overwhelmed at the moment with this job move? Is there other things going on? Is there like implicit, explicit bullying? I mean, it can be complicated as to why we feel overwhelmed in a new job. But yeah, that there would be some things to think about for this person.
Okay.
And sorry, Elaine, just to even add as well, sometimes there could be that, and sometimes it could be the menopausal state, the depletion in the estrogen, the lack of confidence, the lack of concentration. So it's also very important that those changes, a very strong, well together individual can end up feeling like they're falling apart as a result of going through that menopausal stage. And it's very important that you acknowledge that. And like Dr. Roisin said, go to your GP, sit down for that consultation, and Dr. Claire as well, get that holistic view on how to manage it so that you can pass through that stage, hopefully, without too much deficit.
Great, great. So if I start going into some of the areas now, some of the themes of the questions that came in. So I'm going to start with fertility. And Roisin, I might start there with you, but Claire and Lisa and Ogechi may all want to come in on this one. How can a couple optimize their fertility?
Thanks, Elaine. And that's a great question, and a question a lot of patients put to me when they come in for their consultations. So I guess a lot of it is down to very simple things. So lifestyle measures. So first of all, having a very good diet. Okay, and Lisa will probably know more about this than me, but adhering mainly to kind of Mediterranean diet. You're getting lots of fresh fruit and vegetables, lean meat, good sources of omega-3 fatty acids, so nice oily fish, and just trying to eat, I suppose, as healthily and as well as you can, so that you're nourishing that potential baby that's coming downstream. Also, exercise is important. So it's important to stay fit, but I suppose a lot of women, as Claire said, do push themselves in every element of life. So it's trying to, I suppose, limit like high intensity exercise. So doing kind of more low impact exercise, like maybe tennis, walking, swimming, yoga, which is also very good for stress reduction, because obviously it can be a very stressful time when you are trying to conceive a baby. Other things like stopping smoking, stopping drinking, limiting stress where best possible. Also switching over your plastic that you use, so plastic bottles to stainless steel or glass bottles, which are one, better for the environment, but two, it also reduces your exposure to bisphenol A, which is actually quite toxic and can actually be dangerous in fertility. And And then for men as well, another really important thing, you often see men with their phones in their pockets. Really, really important that we, I suppose, talk to men about that and prevent men from doing that. Because of radio frequency ablation, it can reduce the quality and the vitality of the sperm as well, and the concentration. And another key one, I suppose, is really, really important. A lot of pregnancies are unplanned in Ireland, but it's really important that women and men both take prenatal supplements, ideally for women 3 months before conception, to build up your folic acid, which prevents neural tube defects for baby. So there is, I suppose, there's lots in the market at the moment, but I definitely would advocate for ProSeive, which is an Irish brand. They have two lovely kind of, I suppose, brands within their brand. It's ProSeive Conception and it's the ProSeive Max, especially for couples who are having prolonged difficulty with getting pregnant. So a really interesting area.
Yeah.
Yeah, and if I might add as well, I suppose it's the stress and the loss that people feel, certainly if they've been through an IVF process or just even coming up. I mean, there can be a huge journey, and I suppose it's just acknowledging that couples are so busy, there's a lot of stress in life, and that they can be silently or separately struggling and feeling blamed by the other, which is usually not happening at all. But I suppose just the amount of shame that goes with this area, why me, what did I do wrong, and really embodying that there's something wrong. And it's not at all, it's our lifestyle, myself included, much older, coming to motherhood. So there's a lot of reasons, and I suppose it's just that encouragement of people to look at their lives. Sometimes it's relationships in their lives that they don't necessarily need, that are very stressful, and it's trying to, as I call it, the P45 to some people that aren't replenishing in your life, to have a look at any source of stress. It might be overworking, it might be doing too much gym work, or not enough, but just trying to look in a more holistic way about your life, and I suppose the strength in the couple of trying to talk it out. Because I think both the man and the woman, certainly in my experience, carry so much, they can feel very helpless and very alone, even if they've got quite a good relationship. So I just think naming the struggle is really, really key.
Okay. And Lisa, from a dietetic point of view, is there anything to help support fertility?
Well, I think as Dr. Roisin said, it is having a healthy, balanced diet. But one of the key things as well is trying to have try to watch your weight. Try to be a healthy weight and maintain that healthy weight as well. In antenatally and going on into during pregnancy and postnatally, for the woman as well, that maintaining a healthy weight throughout our life has huge benefits for everything, mentally and physically as well. So but as Dr. Roisin said, having a healthy diet, trying to follow the food pyramid or the Mediterranean diet, which is actually quite like the food pyramid in that, we have fruit and vegetables near the bottom, at the bottom of the food pyramid, and the Mediterranean diet is based on having a high fruit and veg intake, which we always try to encourage as well, and having, I suppose, more of a plant-based diet as well, and even planning our meals around vegetables and plants more so than meat. I think a lot of us look into the fridge and kind of say, what meat have we, what will we have for dinner, but we don't necessarily plan it around the vegetables that we have. So having lots and lots of fruit and vegetables, having the oily fish, as Dr. Roisin mentioned as well. And meat is obviously fine as part of a balanced diet as well, but it's looking at our portion sizes of these things, and the amount of things like saturated fat that we have in our diet is important. That for anybody, the amount of meat that's recommended per day is the size of the palm of your hand. So if you think of it, it's just without your fingers, just the palm of your hand and that kind of thickness, that would be the total amount of meat in the day. So if you think of when you're having that meat, and that it's a lower fat, leaner piece of meat as well, is really important.
Okay, and Ogechi, is there anything you'd like to add there?
Yeah, I think everybody has wrapped it up quite nicely. But
okay,
the picture I always get in my head of the fallopian tube, it kind of pulsates. And if you think about it, any amount of stress to that, there's a tendency for it to close in. So exercise, yoga, meditation, deactivating any stress factor will definitely allow that pulsation to start again and continue. And sometimes with women, it's hard. It's easier said than done, because when you have that failed attempt each time, the natural reaction is to tense up, but you need to try and relax your muscles, because the womb is a muscle. All those things, all those movements are smooth muscles, contractions. So it's very important that there is a nice flow. It's hard, but it's possible. And it's taking all these techniques in all one bowl and trying to implement it in your life. Yeah.
Great. So now we're going to move on where you've had the baby, and we're going to go on to what happens afterwards. So Ogechi, I think this is for you. There are some pelvic floor exercises and muscles that we need to keep strengthened. So if we want to start there, Ogechi, with you.
So the pelvic floor muscle is a muscle that, I'll try and wrap it up as quickly. It's a muscle that most women are not actually aware of, but it's a very important muscle for us as women. It has so many functions: sexual function, keeping us continent, helping to hold all the organs in place. And usually after we've gotten pregnant, and even I've seen some cases whereby women have never had children before, still have issues with the pelvic floor muscle. So that pelvic floor muscle supports your bladder, it supports your womb, and it supports the back passage. And with all those organs that it supports, it also has an exit mechanism. So every time you need to empty your bladder, the door has to open for the urine to come out. Every time you empty your back passage, the door has to open for the feces to come out. And again, for the delivery of the baby naturally, that pushing stage is the baby going through the narrow vaginal wall for exit. So if you think about various doors or windows, when you open them, the natural reaction really is to keep them shut so that you prevent any exit or entry of anything that you're not comfortable with. So really, I've put in a link there in the chat box for you to, it's a good video on how a woman should really, where the pelvic floor muscle is and how to contract them effectively. And I would advise every woman, get into the habit of constantly recruiting your, if you don't use your muscle, you will lose it. So get into the habit of constantly recruiting that muscle.
Great. And then the mothers then go back to work, Claire, and that can be quite stressful as well. Going back to work, leaving your baby behind in a creche or a childminder, but then you can have difficulty at night trying to fall asleep or get a good night's sleep with a baby waking. So
yeah, and this is true, and somehow people survive. So I think there's a few things in this. It's trying not to get too worked up. I mean, it's really important. It's vital. It's really part of self-care. But like, I think there's nothing worse than being in bed, checking the clock, going, "Oh my God, it's 12 o'clock. I'm still on it." You know, it's in some nights you won't get to sleep as well as other nights. And if that's happening recurrently, I suppose it's looking at caffeine intake. Certainly, I remember well, new mom back at work, you're exhausted. So the coffee really seemed to be the lifeline, to get you through. But actually, it's false economy. And I would be encouraging people to really cut back on the caffeine, certainly after 1 p.m. as in lunchtime, because it can play havoc in your night's sleep. The other thing is what this woman's routine is, or our own routine. Do we just like running around? It's kind of two full-time jobs, working, whether you're part-time or not. There's full-time work to be done in the HSE, and then you're at home with smallies, which is a full-time job as well. So again, it's back to that expectation. I do the best that I can, rope in partners, whoever, to help with the grind of the lunch boxes and the washing. But it's a lot of people run around, everyone's sorted, and they hop into bed expecting, oh, I'm just going to nod off here. But surprise, surprise, you have no wind down then. It's just been job. So I suppose if it's a struggle, if you're noticing I'm not getting off to sleep, I'd be asking you to give yourself a few weeks to look at setting up a much healthier routine, as in, what about 10 o'clock is down tools? I would be getting the tech, as in your electric phone, I was going to say, excuse me, I'll show my age, your mobile phone out of the room. It should not be in a bedroom. because the bedroom is for sleeping. So there's lights on the phones there. It's all types of distractions. So I would be getting it out, and people say, oh, I read on my phone. I'd be saying, well, I'm sorry, if you have a sleep problem, the phone leaves the room, and whatever it is, you'll hear about it in the morning. And get your old-fashioned alarm clock in the room as well, face down, so you're not staring at it, and just have either a nice warm bath, a bit of relaxation and mindfulness. And we put up some really good Irish developed mindfulness practices, just or reading a book, a good old-fashioned book, but not too exciting that you're kind of staying up late. So again, setting up a routine that come 10 o'clock, this time is yours. You are aiming to fall asleep and go to bed. And the temperature of the room is really important as well, about 18 degrees, not warmer, leaving a bit of the window open. It needs to be airy and it needs to be dark. So no tellies, no phones, no lights, nothing, like black, because ultimately we're animals. And so all sources of light will affect our sleep. So if you're watching telly up to 11 o'clock or on your phone till 11, and then you turn off the phone, which is a source of light, signs on, you won't fall asleep easily because you've just been stimulated up to 2 minutes ago. So I suppose it's just really have a look at your tech, have a look at your caffeine, give yourself permission to have an hour, like just like you do with your kids, you get them all sorted for bed. We need that too, because we're given, I suppose, the signals to our body. I'm getting ready for bed now, it's my time. And any of the arguing or picking you're doing with your partner, that needs to be done early in the evening. Okay, you don't wait till you're in the bed to start into something that was annoying you early on in the evening about the kids or themselves. So just really try, and I suppose I would safeguard that. I think it's a prime step in self-care, is good sleep hygiene. And again, there's a podcast on this that I did a while ago, and it's up there, and you might find a few other tips on that I haven't touched on now.
And there's two questions just come in there. One is about if you get into a pattern of waking at the same time during the night, should you get up or should you stay in bed? And the second one then is, by not winding down possibly before they go to bed at night, they might have some extreme dreams and then they wake up feeling exhausted. So, you know.
Yeah, and I mean, sleep isn't just about what happens after 10 o'clock. I suppose you do have to look at your whole life with this, as in what your exercise routines are, what's going on at work, how you're getting on with your partner. Because, I mean, sleep, one of the functions is we problem solve in our, I'm no Freudian expert on the dreams, but there's a real function to it, not just to replenish the body. So there's two questions there, but like, you're not going to be satisfied with my answers probably, because it's complicated. You have to look at, is it just now? I've never had a problem. It's all out of the blue. And if that's the case, what else is new in your life? Is there anything else that's adding in to the stress? Sometimes the getting awakened at night, is it because you need a wee? Are you drinking either caffeine? Alcohol is a devil in the evening, even one glass of this or that. Usually the liver switches on at about 3 a.m. So if it's around that time that you, as in the liver switches on to do its job. So like, what's your eating and drinking patterns like? I think if it's the same time, there's something probably very fixable about that, why that time, and it can be quite a biological reason. And if not the loo, it is complicated, and I suppose it's more about tracking and looking for changes. And the other question was more about the dreams, and I suppose I don't know what's going on in their lives, but usually our dreams are some bit of a reflection of the daytime, whether there's either traumatic stuff or fighting or just a disharmony somewhere. But I wouldn't worry too much. If you wake up and you can get back to sleep. I mean, most of us don't realize it, but we actually wake momentarily as our 90-minute sleep cycle through the night. So I wouldn't get overly worked up. If you're exhausted, I mean, again, on your age and the whole, I suppose, our menopause kind of focus last week, magnesium is a mighty supplement that we need as well. It can certainly, anecdotally, can really help with sleep and getting into that deeper sleep so that you're not waking from an active dream. And I suppose just if you can listen to the podcast, there might be some ideas there.
Okay, thank you very much. And I think that's going to bring us nicely now into some questions in relation to menopause as well. And I see one here on the that's just come in on the questions, and it's maybe again for you, Roisin, if we start with you. It says, I'm confused about when perimenopause begins. Is it 36 for everyone, but you might not have symptoms, or is perimenopause only when you recognize the symptoms?
Yeah, so I guess, thanks Elaine, the average age of the menopause is 51. So many women will, I suppose perimenopause means transition into the menopause. So that may happen a couple of years before you actually hit the menopause. Now we say the average age is 51. Some women can transition through the menopause as early as in their 30s. Premature menopause is very common. It happens in 1% of women. So I suppose that question is a little bit tricky to answer, but I suppose if we're taking the average woman of 51, then you would expect women to have some perimenopausal symptoms at least 5 years before that time. And menopausal symptoms.
Sorry, I was just going to ask you there, you're just starting into what are the menopause symptoms people should understand?
So there's a lot of menopause symptoms.
Okay.
So they can range from, I suppose, the most common ones would be vasomotor symptoms, which are like hot flashes, night sweats. That would be the most common one. Then we would have urogenital symptoms, which could be symptoms that mimic urinary tract infections, vaginal dryness. Sexual symptoms are another feature of the menopause, so reduced libido. I mentioned the vaginal dryness, which can lead to difficulty having sexual intercourse. Then you have your kind of psychological or cognitive symptoms, and these can range, there's a plethora of symptoms here, so it could be anything from anxiety to irritability to low mood. Sleep disturbance, I guess, as Claire talked about, that can hit at any time of your life, but it particularly seems to be a big symptom that affects women during the perimenopause. Brain fog, just a feeling, I guess, that lack of clarity. Then there is a lot of kind of general symptoms, which are sometimes a little bit hard to kind of pinpoint maybe until after the event, which could include symptoms such as headache, skin disturbance. So you might have sudden onset of acne, dry skin, itchiness under the skin, joint pains. So the symptoms are endless, unfortunately, but I think sometimes it's kind of patients kind of looking back and saying, actually, that was the perimenopause, because they know they hit on nearly all of those symptoms.
And if a lady has gone through the menopause and is out the other side of it, but continues to experience the symptoms, like the hot flushes, the brain fog, for example, what are they out the other side or are they not? And how long do they think they're going to continue? How long will it continue? Yeah,
so the average duration of perimenopausal symptoms can be around 7 years. So again, it is individualistic. So some patients will have absolutely no symptoms of the perimenopause. Other patients or other women will have all of the symptoms that I've talked about above. So it's, again, very individualistic, but the average duration of symptoms is about 7 years. And we will see women who are taking hormone replacement therapy for menopausal symptoms, at 60, at 70, and sometimes women are afraid to stop HRT because they're afraid that their menopausal symptoms will come back because they were so bad. But so again, I mean, in that instance where you have women who are on HRT kind of beyond kind of that 7 years, you would suggest to them maybe just trialing coming off HRT or reducing it down a little bit to see if their symptoms recur. Because we don't really ideally want women to be on HRT over the age of 60. And if we do women on HRT over the age of 60, ideally we like it to be at the lowest dose possible, and I suppose in a transdermal, or ideally like as a gel or a patch or something that's not as systemically absorbed.
Okay, and there was a question there, can women take testosterone therapy during the menopause? Just when you're talking about it.
Absolutely. I mean, we touched on kind of, I guess, some of the sexual symptoms that women experience, such as like reduced libido, dryness vaginally. So testosterone can be a good add-on treatment. I would always suggest HRT first, because HRT will cover all bases. And it's also going to help with some of the sexual symptoms. But if a woman is struggling with the HRT and she's not having any relief from the sexual symptoms, then absolutely we can add it in. Ideally, we would add it in with a transdermal form of estrogen rather than an oral estrogen, because an oral estrogen can reduce the effectiveness of testosterone. That is kind of, I suppose, the guideline from the British Medical Society, that we would, the British Menopause Society, excuse me, that we would start with HRT first, see how that helps the sexual symptoms. If after 3 to 6 months it's been successful in treating all of the other symptoms, but it hasn't hit on the sexual symptoms, then you could add in the testosterone, is what we use commonly here in Ireland. Yeah.
Okay. And then on to that, then again, a lady has gone through menopause and they're no longer fertile. When should they stop contraception?
So for women who go through the menopause under the age of 50, they would be deemed to be no longer fertile after 2 years. For women who go through the menopause after the age of 50, they're deemed no longer fertile after a year. So a year after their final menstrual period over the age of 50.
Okay.
Yeah.
Okay. And just in relation then to menopause, I think one of the questions there was in relation to a DEXA scan for scoliosis, because there was a family history and they were wondering whether scoliosis was impacted by the menopause or whether it disimproved with the menopause.
It would be more, I guess, due to like estrogen deficiency. Maybe Ogechi would be better at answering this question than me, but I would say like due to estrogen deficiency around the time of the perimenopause, you are at a reduced risk of osteoporosis. I think Ogechi would be better at answering this question than me.
I had already actually typed back to the person.
Had you? Okay.
Yeah, because scoliosis is actually different from the osteoporosis. And I understand that there is a family history in terms of scoliosis. So what I asked the person actually was that, were they actually ever diagnosed, even though there's a family history of scoliosis, were they actually diagnosed with scoliosis? And yes, if there is scoliosis, because osteoporosis, almost, if you notice the wedging, what happens is that all the vertebrae begin to flatten and begin to become weak. Yes, there's a high chance that it may be pronounced, but any patient though that has a history of scoliosis would be followed closely by the GP towards that menopausal stage to ensure that they don't suffer as bad, because any further increase in the curvature of the spine will affect the ability for the ribs and the lungs and the breathing, so, and the heart as well. So there are so many implications. So usually the GP will follow those patients closely. If the scoliosis has not even been rectified already before, usually they manage it very closely. So please link in with your GP, check all that. But if you haven't really been diagnosed by now and you're already close to the menopausal, just get the DEXA scan just to check your levels, and then take calcium supplements and all. Don't worry about getting the scoliosis now, because if you've escaped it for that long, you should be fine towards the end. Yeah.
Okay. And just back to the HRT, I see another question there. Should HRT be considered at peri or at menopause stage, and what are the benefits?
Yeah, so depending again on your perimenopausal symptoms, if they're very problematic, absolutely you can start HRT at that time. We use a different format of HRT for women who are in the perimenopause who are still having periods, as opposed to a woman who has transitioned through the menopause. There's a lot of benefits for HRT. Obviously, it's relieving all of the symptoms that we've discussed, which is a huge benefit. It can also reduce your risk of cardiovascular disease and reduce your risk of cognitive impairment, such as dementia. They're really, really important. And we also talked about osteoporosis, which is a really, really big one. So it can reduce your risk of osteoporosis in the future. So lots of benefits for HRT. I think the big thing that scared people previously when discussing HRT was breast cancer risk. So we now know, I suppose, that there is a very, very small increased risk of breast cancer with HRT. And if we actually look at other lifestyle factors, such as like drinking, smoking, your risk of developing breast cancer is actually higher with alcohol consumption, with a woman being with a BMI of over 30. So we now know, I guess, that HRT is a lot safer to prescribe. And I think women are more aware of that now, and I can see it in my own practice that more and more women are coming in and asking about HRT, looking for the prescriptions to improve their quality of life around this time.
Great, great. So I suppose I'm good. This is just a quick general one for everybody. Should the HSE have a policy for menopause? We heard last week, I think on World Menopause Week, that the Bank of Ireland was bringing in one. So maybe I'll start with you, Claire. Do you want to start? You're on mute, Claire.
No, apologies. I was just typing back on one of the questions there. I would say absolutely we do. And whether the policy is developed simultaneously throughout different departments or nationally, but that obviously the stakeholders, as in the women, whatever age you are in the workplace. I mean, we have a breastfeeding policy. Not every woman in the HSE will have a baby and breastfeed, but we have none for menopause, and every one of us will experience the menopause. So I think it's a done deal. I'm sure there is work afoot. It's a pity it's taken us this long, but I think absolutely, why not? Policies are generally there to help us and to help management and help staff know how to manage this better.
Okay. And I think there's one last question in here. Again, it's about the HRT. And what's the reason to stop HRT after the age of 60? If you're on transdermal HRT, my understanding is that new data suggests continue indefinitely, especially if you're still having the debilitating symptoms.
Yeah, and absolutely. I guess, you know, ideally, I suppose we want women to be on the lowest amount of HRT, and ideally transdermally, to reduce kind of, I suppose, systemic side effects of estrogen. That's what I would suggest. If a patient has, you would expect, as I mentioned, the average duration of perimenopausal symptoms is about 7 years. We would expect that by 60, most women would not have perimenopausal symptoms anymore. So that's kind of where that kind of comes from, that kind of 60 kind of little cutoff area. But we do have patients who are on it over the age of 60. And yes, I guess like breast cancer is your biggest risk. Yeah,
okay.
with HRT.
Thank you.
Yeah.
Thank you. And we're now coming to the end of the session, which went through very fast, and we've hit on a few themes there, but we could have spent a lot more time at them. So just before everybody goes, I'm just going to go around the panel and just ask them, for Women's Health Month here in Community Healthcare West, what would be the kind of your parting piece to everybody as they go away? What would you say to somebody? So I'm going to start this time with Lisa, if that's okay.
Okay. Thanks, Elaine. I suppose just some of the symptoms and things that Roisin was talking about there, even in terms of menopausal symptoms, some of those can be alleviated a little bit with diet as well. And it is all about kind of general healthy eating. Like a lot of the time, some of those symptoms like headaches and dry skin and those kind of things can be helped even with drinking more. You know, most people don't drink enough fluids really, that people are dehydrated and don't realize, and sometimes it's camouflaged as hunger, so they go for food before they go for a drink. But if we could all drink a little bit more water, that would help us all. And I suppose just thinking about the amounts of different things as well. It's what a water cup that's out of a drinking dispensing machine. This is a 200 ml cup. This is the measuring tool we use for most things in the diet when you look at the food pyramid. So next time you do go to the water dispenser, take the cup home with you and use it to measure some of the things. I suppose there's a lot of things that we can do, but my take home would be to try and change, you know, one or two things, particularly in relation to diet. There's so many different things we hear, and lots around menopausal things. I suppose that things like skipping meals, you know, can have an effect as well. And there's a little bit of kind of research saying, you know, there's some evidence showing that it can increase the severity and the occurrence of hot flashes as well. That if we don't have regular meals, you know, that's again back to kind of balanced healthy eating, to try and have the regular meals. Things like soy and linseed can help as well with things like hot flashes. And again, that's all back to the plant-based diet, you know, that if we can have more of that kind of food as well.
Thank you.
All general healthy eating should help us with all stages throughout life.
Thank you very much. I'm just conscious there's 1 minute left, so I'm going to go to you, Ogechi, if you want to give us your parting takeaway.
Just stay positive, really. Don't give up on your body. Go and look for help. Just always ask somebody. You will surely find an answer someday.
Thank you. And Claire?
Yeah, I'd say prioritize yourself in your own life. A lot of women don't, and the menopause is what we make it. It's not necessarily scary. It's a real creative time for the majority of women as well. So just, yeah, be brave, get the help, and there's loads of it out there.
Great. And Roisin, finally.
Yeah, and just following on from Claire's words there, I guess like we are pretty amazing individuals, and I think we need to kind of acknowledge that. And if you look at the word women, it is men plus W0 or wow, I like to put on that part. So I think that's really important to remember. Like we are the ones who carry the babies, do a lot of the work, I think, and also working another job as well. So I think we need to be really give ourselves a pat on the back and say well done.
Great. So thank you, everybody. I'd just like to thank Roisin, Claire, Ogechi, and Lisa for their wisdom and knowledge here today. I'd also like to thank people that work behind the scenes, especially our own planning committee here, who worked on this for today. There will be a list of resources emailed out to all attendees after the event. So if you missed any of them in the chat box, we can get them sent out. So thank you for attending the webinar. And I'd just like to reiterate the importance as women that we focus on our health and well-being through all stages of our lives. Thank you and goodbye.